Hi, Dr. Garima here again, and we'll be solving another scenario based question for the Australian Dental Council exam. And like I'd mentioned, this mock 2 is predominantly prosto based, which is good for you all because most of you feel that your prosto is weak, right? So I'm trying to give as much as specific explanation with the references so it helps you all. Let's start solving the question, then we can discuss other things so that at least this is finished before my son comes from his play area and completely hijacks my time. So today's question is based a bit about complete denture and one of the problems associated with it. So let's do a little bit of theory before jumping onto the question so you're aware of the options to choose, because now you have brushed up your concept. Yes, we are talking about vertical dimension at rest or vertical jaw relation. Now, what is vertical jaw relation? We either say it as vertical dimension at rest, that is VDR, or vertical relation at occlusion. So, basically, the space which is obtained of VDR, that is vertical dimension at rest, when the patient is resting and the teeth are not in occlusion, and the space that is left when the teeth are in occlusion, that is VDR minus VDO, that is called as the freeway space. Now we all know it is normally supposed to be 2 to 4 mm. Now what happens if it is less than 2 mm? That means when the patient is resting and the gap between the teeth is less than 1 mm, that means there is increase in vertical dimension at rest. There is decrease in vertical dimension at rest, yes. That means there is increase vertical relation at occlusion, basically. So when there is increase in vertical relation of the mouth, basically your mouth will get stretched, That means the freeway space is less. If the freeway space was more, that means the vertical dimension at rest is less. You're getting my point? So just remember, if the dentures are made bigger in size, the jaw is gonna stretch out and if it is very less, then there will be drooping of the cheeks like this. So I'll show you with pictures. It is not complicated, but if I continue to say VDR and VDO, you will get complicated. So I'm trying to simplify it so that you don't get complicated. So let's see here. Effects of increased vertical dimension. I will just say vertical dimension from now on. I will not say rest or occlusion. So increased vertical dimension of the face. Okay. So say if your face, it's calculated from the base of the nose to the base of the chin. For example, originally when the patient had the natural set of teeth and it was say 7 centimeters, and when you gave the dentures it became 8 centimeters. So basically there is increased vertical dimension. So what will happen? First of all, it will be discomfort to the patient because the muscles are stretched. You cannot keep the mouth longer than what naturally it was. There will be trauma and pain under the basal seat areas of the denture. So where the denture is resting on the ridges, there will be trauma and there will be pain, and that pain would gradually increase during the day because at night the patient had removed the denture, so there is no pain. But in the morning he got up and wore it, so slowly the muscles started aching, and as the day was progressing, you will get a question like this, that there is increased pain as the day progresses. Classical sign of increased vertical dimension, okay? Loss of freeway space, muscular fatigue of any one of the group of muscles of mastications. In turn, results in annoyance from the inability to find comfortable resting position. See, normally when we are sitting, we are actually not biting. When the teeth come into occlusion, only when you swallow, that's it. Otherwise, the teeth do not come in occlusion at all. Not even when you're biting, because the food is in between. And when you're talking, no, when you're resting, your mouth is like, or even if the lips are competent, the teeth are not like clenching. The only time the teeth come in contact is when you swallow. Try. I know it's strange, right? But that's true. Clicking sound. When the occlusal vertical dimension is increased, opposing cusps will frequently meet each other and produce an embarrassing clicking sound. Like this. Appearance. It's elongated appearance. Bone resorption will happen due to continued pressure on the ridges, loss of retention and stability, generalized hyperemia. Basically, there will be kind of increase in blood flow and the mucosa will become reddish, you know. That is effects of increase in vertical dimension. Now what happens when there is decreased vertical relation, meaning there is extra space, the freeway space will be more than 4 mm. Then there will be inefficiency, like the pressure for the biting would not be sufficient enough because the teeth are far away when the patient is trying to occlude. Cheek, tongue and lip biting will happen. Appearance, the denture look, you see this kind of a witch-like appearance, that will happen because the muscle is going to sag around here. Now what happens when the muscle starts sagging around here? The folds develop, as it is when you grow old, wrinkles appear, and those folds will lead to pooling of saliva, and saliva and bacteria over the skin will slowly result in angular chelitis, which is called as perliche in case of denture. Also there will be pain in the temporomandibular joint because overclosure is going to happen. So one of the classic signs of decreased vertical dimension is perliche, that is angular chelitis. Classical sign of increased vertical dimension is clicking and gradual increase of pain as the day progresses. Remember these 3 points, and if the question is mentioning, you know what the problem you're going to have. Now having known this, I would like you all to go to slideshare.net, go to this Kelly Norton vertical jaw relation. There's a nice presentation over it, how to measure it, how to make it, the problems associated with it. You'll feel more confident in your complete denture then. And once you have done that, let's come back to the question at hand. So what's the question for today? Where am I? Yeah. A 60-year-old patient presented at your clinic pointing to a bilateral lesion at the corner of the mouth. She is wearing full dentures. The corners of her mouth are painful. On intraoral examination, you noticed a lesion underneath the upper denture as well. So there are 2 problems. One is this, which is the chief complaint, and then you observed a lesion beneath the upper denture. Then what is the diagnosis of the lesion at the corner of the mouth? We just discussed, right? Angular cheilitis. Denture stomatitis happens on the palate. Herpes infection, you cannot rule out, but then they are just not at the corners. They can be anywhere here over the gums. It doesn't have to be just at the corner. Shingles, a same form of herpes. No, none of the above is not the right answer, because we know patient is wearing dentures. We can see the wrinkles. We can classically see the perliche kind of lesions. It's angular cheilitis. What could be the cause of the lesion at the corner of the mouth? Viral infection. If it was herpes, then we could have said viral infection. It's not viral infection. There is no history of fever. There is no other malaise. There is no other symptoms. No. Increased vertical dimension will not cause perlicate. It will cause clicking and pain. Excess salivation. Decreased vertical dimension, yes, because that would cause, as I mentioned, pooling of saliva because of the sagging of the skin on the corner. Bacterial infection, no. Actually, fungal infection is the cause. If they would have mentioned fungal infection, you could have chosen that. It's not bacterial, it's fungal infection. That's why you always give a topical either miconazole, nystatin or amphotericin. You don't give antibacterial creams, remember? Perliche, vitamin B12 deficiency or this angular cheilitis, you always give antifungal. What can be seen on the palate? Remember the question also mentioned there was a lesion beneath the denture stomatitis. Erythroplakia, denture hyperplasia. You may be confused with hyperplasia, but hyperplasia, what does it mean? Hyperplasia. Hyper means increase, plasia means increased growth of tissues. So they would have been flabby tissues, but do you see flabby tissues? No. Stomatitis. Stoma is the oral cavity mucosa. Itis is inflammation. Always remember, anything itis is inflammation. Periodontitis. Pulpitis. You understand? Stomatitis. So this inflammation because of the denture. Itis of stoma, inflammation of the mucosa because of the denture. That's why it is called as denture stomatitis. See, most of our diagnostic terms, the diseases are taken from Greek and here and there, and for them, for example, in their language, itis is inflammation, mia is blood, bacteremia, polycythemia, poly is increase of cells, cythemia, blood, increase in the cell count in the blood. You understand? So if you break down the words also, you can get to the answer, but then you should have that knowledge. Where is that knowledge? In your basic dental books. in the starting few chapters, which you always tend to skip out, right? So you have to be a nerd like me to go through those chapters, because it gives you beautiful understanding from where these terms actually originated from. And when you understand from where they have originated, it becomes very, very interesting to read. You're not just mugging up, you know. That's why I am very grateful that I was a nerd then, so that I can help you now. But it's not just being a nerd. I really loved studying, you know. I love history. I really like to know from where things have originated, why the way we are, and from where this entire history is coming. You can actually judge a species by their civilization, you know, which often helps me when I treat patients. I get patients from all parts of the world, and I can understand their nature a bit, because from the civilization from where they have come from, you know. So anyways, that's another topic to discuss, but it's really interesting. So dentist stomatitis is the answer here. What will be your first line of treatment for the palatal lesion? Okay, so we have inflammation there. It's inflammation, not infection, right? Why did the inflammation happen? Probably due to poor dental hygiene or denture hygiene. So what is your first line of treatment? Whenever, see, first line is the kind of adjective out here, because all the treatment would be right. But which is the first line of treatment that I'm going to choose? It's like the patient is coming to you with a little inflammation of the gums, and you see a lot of plaque there. What is the first thing you're going to tell the patient? Maintain oral hygiene, please. Then you will start cleaning and applying something. But the first thing, you understand why this has happened, because the patient wasn't brushing. Similarly, the first line of treatment, proper denture hygiene. Nystatin lozenges, make a new denture, give antibiotic, chlorhexidine mouthwash, all are correct, but that's not my first line. My first line is just maintain proper denture hygiene, because the option B, C, D and E is treatment. I treat, it would be good for a while, but then what? You're going to go back to the same scenario if you don't maintain proper denture hygiene. So first line, start maintaining that, then I will treat, and because you have started maintaining it, you will not go back to that position. Patient comes back after a month and the lesion has not healed. Now what would you do as the next step? You say, alright, it's a fungal infection. I'm not going to give antibiotics. I'm going to give antifungal. What antifungal I give? I would like to give something which I can apply topically. So I will go with the option which says topical application, which is miconazole 2% topically inside the mouth and on the denture. Option D is right, but option E is more correct because it's on the denture. Nystatin drop 100 units. I think it's 1 lakh unit. The unit is wrong. If it was 1 lakh unit, rinse the mouth and swallow it, even that would be the right answer. But it says 100 unit. It is actually 1 lakh units. Antibiotics now. Amphotericin lozenges 100 milligram, not wrong either, but I would choose my miconazole topical application over a systematic intake. Hence, I'm going to go with option E. If you're going to solve my mock, I have given in detail the steps of what the answer should be in the feedback. So you will get that. This is a brief explanation, but again, you can pause this video, go back and see from your own textbook what all medications in what order you should be given. But anyways, if you're solving one of my mocks, like this one, the second mock, then you will get in the feedback the answer, so you don't have to like search that much. But I would prefer you searching that much, because then you'll search, not only that, you'll come across other theory as well, which would, you know, make a stronger your base. But if you are in a rush and you have small time, like short time rather, then you can just solve the mocks and get the feedbacks, and you should be good to go. So yeah, that's about it, and I'm still wearing my scrubs. I came, I slept, I woke up, and I was like, let me shoot this video before I get busy. It's weekend, Saturday, long day. I'm just craving for some dessert today, like I don't know why, after a long time. I don't know what, I crave for a tiramisu today, and I'm too lazy to make one right now. So let me search around where I can get one. I mean, sometimes, you know, you just crave for some sweet, just like that. Maybe it's a weekend, so the weekend brain, you know, you should go out, go have some fun, but it's so hot outside at the moment. But let's see, it's almost gonna be 9, so it may be okay. But anyways, I hope you liked this video and it helped you to understand some things. Leave a comment. As usual, I really love reading it, and see you next time. Bye bye.